As Illinois hospitals race to rehire and cross-train staff to treat sick patients, one study suggests we may soon run out of places to put them. Capitol Bureau Chief Mark Maxwell spoke with hospital executives racing to create space in intensive care and to tech experts working to reduce overcrowding in the fight against COVID-19.
We are going to be filling up ICU beds across the state.
Illinois hospitals are bracing for a surge of patients who may need intensive care. But for many hospitals in rural downstate Illinois, that is an uphill battle.
There are critical access hospitals that may have fewer ICU beds.
Statewide, 70% of ICU beds were already in use at last report Friday, and 35% of those patients already sick with the coronavirus. The state plans to publish updated figures Tuesday. One University of Washington study projected Illinois could reach its breaking point in just 2 days, with more ICU patients than ICU beds available. But that study doesn't take into account the latest data from local hospitals who have already been in a race against time. Chuck Callahan is the president of the Memorial Hospital System.
We're using the time we have now before a surge would arrive to prepare.
When a COVID-19 cluster broke out in a Taylorville senior home, their critical access hospital took them in.
We're accelerating some renovation to get more beds in place, and certain units that don't act as intensive care units today, frankly, could be turned into intensive care units if the surge would require it.
The fight against COVID-19 requires manpower and brain power. OSF Healthcare turned to artificial intelligence to stem the tide of patients flooding their 14 emergency rooms in search of a test.
Based on how sick they project that patient to get, they can go in different pathways through the emergency department, and it also cues them and prioritizes them for the right resources in the hospital.
Even if Illinois reaches its peak, hospitals still have room to maneuver.
Either offloading the non-acute people who are in the hospital, the patients in the hospital, or we're providing additional facilities for people to have, ICU capability.
Reporting in Springfield, Mark Maxwell.
Memorial Hospital told us right now they do have enough ventilators, and if it comes to it, they are prepared to share the devices and put 2 patients on 1 machine.